Hello, good evening. Welcome to Chai with Dr. Charan. Today we have a super interesting live about self-love. So for the people who are new here, I'm Dr. Charan Koganti. I'm a consultant neuropsychiatrist from Hyderabad. I work with KIMS hospitals. I'm doing this series called Chai with Dr. Charan, basically to destigmatize some mental health issues. So it'll be easier for you to understand what you're going through and probably also maybe seek help if needed. So today's topic is called self-love. Very interesting topic, which I completely believe in. We'll wait for Dr.Era to join us and we'll go ahead. So today's live is going to be just for half an hour because the cases are high and so our jobs are getting hectic. So any questions you have, you can please post. I hope all of you are ready with your cup of tea. How can we get an appointment? You can call KIMS hospitals. I work with Kondapur branch, or you also have a number on my profile. You can take an appointment there. Yes. I'm gonna invite Dr. Era. How to consult me? KIMS hospitals, Kondapur, or you can call the number on the profile. Hi,
Hi, how are you?
I'm good. How are you?
Visible, audible?
Yeah, yes.
Okay,
Perfect.
good.
What a
I'm
lovely
finally getting to
evening.
meet you actually. Yeah, we've never met, but I think virtual life has made it so much easier to meet people these days.
Yeah, the new normal.
That's right.
So, can you please introduce yourself to the viewers?
There's not much to introduce. My name is Dr.Era Dutta. I help people for a living with their mental health. I am a consultant psychiatrist practicing in the city of Joy, Kolkata. And I love talking to people, understanding their points of view. And I also love my chai. That's why I'm here on Chai with Jared with my chai. Yeah. That's about it. I'm a very simple person with very basic needs, and I think making mental health a household name is something that I wish I can do at some level at least.
Yeah, you're doing a great job, by the way. I
Thank you
keep
so
seeing your
much.
videos.
Likewise. Thank you so much.
Thank thank you. So today's topic is self-love. So we have some of the questions, right? What exactly is self-love?
It's not as complicated as people make it sound. It's not rocket science. It's surely you don't definitely need MD or MBBS degree to get into self-love. That's rule number one. So before we even talk about like what is self-love, I usually bring this topic about very often in my consultations with people. Like, I casually ask them, maybe in some context, like, so who do you love? Some of them would obviously be very upset with the word love itself because they may have gone through a heartbreak. But a lot of people are open to talking about love, and I say, okay, so who are some important people that you love in your life? And very often, like for mothers, it's like, oh, my child. For people newlyweds, or for people in relationship with their partner. Sometimes it's parents. Sometimes it's I love my job. A lot of things, a lot of people that I hear about, but very few people take their own names when it comes to love. So that's why the concept of self-love is so missing from our this thought concept. As children, we're always taught to be selfless. We're always taught to give somebody else something first and not even think of ourselves, right? Mothers are always feeding the children, not feeding themselves. So the
Themselves.
concept of self gets lost somewhere in our minds as we grow up. That's what I strongly believe. And that's why when people are crying or they're upset, I say you're here for yourself and you're not counting yourself on your I am important to my own self list. then how will this relationship work? And that's usually the eureka moment. It clicks like, okay, yeah, there's something, somebody, someone called self. So yeah, self-love is very simple. It's what you do for yourself. The very little to the very big gesture doesn't matter. It could be very tiny, tiny, tiny gesture like this cup of tea you and I are having right now is self-love too. What is your
Yeah.
definition of self-love?
I think for me, self love is basically putting yourself first without being selfish, at the same time caring for others' needs and emotions as well, but not at the point where my health is getting affected, till a point where I can do, not beyond my capacity. Because, like you said, we're always trained, especially doctors are trained to be selfless, all the time. Like we don't have any professional boundaries, right? I mean, I didn't take my lunch
I
breaks.
strongly create. No, I strongly create mine. I'm sorry, I'm a little different.
Yeah,
I take my Thursdays off. I've been doing it since private practice for very long. Very rarely do I work on Thursdays. So most of my clients, most of my friends, most of my everybody around me knows Thursdays are her week or week off because it's my day for self. And people go
right.
like, why Thursday? I'm like, no, there's no significance. There's no
Yeah,
magical this thing.
there's
It's
no
just the day
story.
where I find time for myself and I
Hmm.
literally sit down and kind of, see what else can I do. And I get so much done for myself. Not for the house, not for the baby, not for my
Yeah,
profession,
yeah,
but just for myself.
yeah. Hmm.
So yeah, I know doctors are notorious for not prioritizing themselves.
I mean, I don't know if you're given too many options to take time for self, but in little ways that I can, I do practice self-love without labeling it as self-love. I always try to put myself first. I always try to take care of my needs, my emotions first, and then probably I can serve better for my patients or my, family members as well. So self-love is just putting yourself first and not let anyone treat you less than what you are supposed to be treated. Yeah.
Absolutely, absolutely. That's very
But but
important.
but but when you say self-love, Dr. Era, two words are usually associated with it, right? First thing is selfish. Second thing is self-obsessed.
Yeah, that's
Yeah.
so common. It's very, very notorious for being misconstrued for those two words. In fact, somebody left that question in one of the stickers too, that how is self-care not selfish? Now,
Hmm.
you put it across. I strongly believe it's about prioritizing when what needs priority. Not
Yeah.
that it's always me first at the sake of
Hmm.
putting somebody else's need down. If God forbid my child is sick, obviously that takes precedence over self love also for that day. I may
Yeah.
not eat my meal properly. I may not sleep very well that night. But it's about prioritizing. So selfish would be always saying me first, me first, me first.
Yeah.
I should get the biggest cookie. I should get the
Yeah.
biggest chunk, right? Second thing is I always say about selfishness that okay, when you're on a plane, the air hostess says this, and I think by now it's become like a white noise that we all ignore. But they always say, please fasten your own oxygen mask and then put on the one for the rest of the people. So that's not selfish or self-obsessed. It just says that if you're around, you're going to be taking care of more people. So you're
Yeah.
not fending for your own self and being selfish and out there, but you're just being more reasonable if you are refilling yourself, because then you have enough charge, enough power, enough battery to help others as well, right? And
Yeah.
about self-obsession, I think healthy bit of it may not be really dangerous. Again, as long as you're not ignoring others' needs, as long as you're not ignoring other important aspects of your life. So yeah, that's what selfishness and self-obsessiveness.
Yeah. Yeah. I mean, to be honest, people think that self-love is such a luxury. Like only people who have time and who has probably money or
Money,
some privileges,
yeah,
yeah, money or privileges can go like to a spa, pamper themselves, and whereas a middle class person who is working day in and day out can have self love. So self love is not just about pampering self. It's not about that. Uh, Actually speaking, the people with no much time for themselves are the ones who are in more need of self love, not the other way around. So we're talking about practice self-love, right? I mean, I always tell my patients, put yourself first. It's important when it comes to even as crucial thing as feeding your own child, breastfeeding your own child versus you taking medications for depression. I say that you have to go ahead with taking medications or therapy or whatever works for your depression, rather than taking care of baby's hunger, because there are other ways to take care of baby's hunger. But your own mental health, there are no other ways to take care of it, because mothers are constantly trained this whole, loaded with this whole
Guilty.
nonsense of selfless,
Guilty as
the selfless mother.
charged. Yes, yes.
What do you think? I mean, how can we'll talk about mothers first. How can mothers put themselves, um, give themselves that kindness and empathy that they need to?
This is right up my alley, I believe, not only professionally but personally as well. And thankfully to the training, we've been exposed to so many concepts. But this is a concept I always tell everybody about, called the good enough mother, the good enough parent. So there's a very nice concept in psychology which says that children who grow up with parents, whose parents, specifically mothers, make mistakes versus those who do not make any mistakes at all, actually fare better, because their parents are setting up realistic standards for them. Meaning it's not like, oh, my mother is this superwoman who never flaws, and that's why I would need to kind of match up to. Children always look up to us, right? So the child would be pressurized, oh my god, I need to do better or as good as my parents. So making some flaws, making some mistakes is human. To err is human.
Yeah.
But as mothers, people start thinking, I should do it all, know it all. I should be a pediatrician. I should be the best cook. I should be losing weight. I should be doing so much. So at that time, definitely, that's one of the hardest jobs out there. And in all due respect, I mean, men do their part these days. I completely understand. But then just carrying a child is so hard, and nurturing another human being the way a mother does is just so hard. So I tell mothers that don't pour from an empty glass. That concept, that if you are well, if you are full of energy, you can run behind your toddler. You will not scream at your toddler. You will not hit your toddler. You will not, be expecting your child to be a certain way, because you have the energy. But if you are not taking that adequate rest, if you're not getting that shut eye, even for that 5 6 hours, is fine.
Yeah.
I'm sorry, yeah. So my social media stops after 30 minutes of usage, so it went off. It said like, get off.
Great
Great,
tip.
30
Great
minutes
tip.
are done. I do that. I put these like small mouse taps to myself throughout my digital tracking. So then it said like 30 minutes are done. So anyways, I was talking about mothers, that mothers really need to understand that it's not me first, it's also me as well. And
Yeah.
it takes some time. It takes some getting used to. I hold workshops for mothers time and time again, and they're very profound. They're very interesting because I see myself in some of them. I was one of them one day that, oh no, I need to give my child a massage, I need to shower my baby, I need to feed my baby, I need to do everything. And then I learned it the hard way that I can't do it all. Ask for help. That is also self care, isn't it? That,
Yeah.
giving the baby to your husband or your, family and saying, please take care of the child. I need to take a long shower. For a new mother, that's self care and that's
Yeah.
luxury. So that's why
That's luxury.
self care does exact to be self care doesn't have to be expensive. It's cheap. Go for a long shower. That's self care.
Yeah. I mean, I tell all the mothers the same thing, it doesn't have to be that one big thing that you do for yourself. It can be tiny little things throughout the day that you can take care of yourself, in many little ways that has more impact than that one big thing that probably you do.
I agree.
Also, one major part of self-love is asking for help when it's
True.
needed. This is again, especially for new mothers. Please ask for help. Ask your partner for help. Ask your parents for help, because we become a population of very independent youngsters and adults. We don't want to take
True.
help. We want to do it all by ourselves. I know. I mean, that's a great virtue, but sometimes things are beyond us. You're supposed to ask for help. It can be your therapist, it can be psychiatrist. Before even getting there, you can start taking help from your family. I think that's one way of taking care of your own self, so you don't overburden yourself,
True.
right?
It takes a jungle to, it takes a village to raise a kid. I mean, I would say jungle because village is very
Village,
disciplined.
yeah.
So it takes an entire village or a jungle to raise a kid. You can't do it on your own. It's very hard.
Yeah. Yeah, yeah. You know, one
You have
one
kids?
thing
I
when you
mean,
say
hate to know. You
no,
have kids? I mean, hate to know. No.
no, no,
Okay.
I don't have
So
kids.
okay.
I'm dreading.
It's a beautiful mix.
Yeah, yeah. So one more thing, I'm seeing a lot of youngsters. They're coming with self-hate. They hate their bodies. They hate their personality. They hate the person that they are, and they want to become someone else. And what is the message for all those youngsters or teenagers?
So I first of all try to reframe their thought of hate into deficit. Meaning, between love and hate, there is a middle ground. Maybe the lack
Yeah,
of love and maybe the hate is just starting to get there. So we use words like dislike instead of hate with them because the more you say the word hate, the more, it creates a negative impact into your cognitive restructuring. So this is a very popular term being floated around these days. It's not a medical term, of course, I must say it since we're both NB doctors. But there's something called self-love deficit disorder. So one person walked into my clinic and said, "Oh, I have SLDD." I said, "Wait, specific learning disability? What? What now?
what have I
What
missed? What
LLD?
have I missed
What
in
is
my
the
med
last?"
school?
I know, I was like, "Wait, what?" I literally went like, "What? Are you sure there's a double D?" And he was like, "Yeah, self-love deficit disorder." I said, "Very fancy, very cool. That's right." But of course, what this person meant was that the self-loathing, the poor self-esteem, the not liking the body image, all of the boxes ticked exactly like you said, but they had a fancy term for it. So I thought, why not? It resonates with people. So the self-love deficit is probably a better way of saying the word hate because hate is a strong word. There are a lot of virtues which need to be kind of worked upon. A lot of people develop them with harsh parenting. A lot of them develop it because of abuse, trauma, uh, stressors, incidences in their life which are beyond their control. So, without judgment, with a lot of empathy, with a lot of work, with a lot of, I think, restructuring, cognitive relabeling, rewiring, I think there is some scope of improvement, and many people go on to do very well and like themselves eventually, and at least not hate themselves. That's the whole point. But yeah, it's a very slow and steady work because nobody starts to hate themselves overnight, right? So nobody starts to even love themselves overnight. So I'm sure we hate ourselves on days, so using the strong word again, but there are days that we dislike that how our day went or how we did or how we behaved with someone.
Yeah.
There's there are days which are not that great, and that's where self love is needed all the more, in my opinion.
Yeah, yeah. I also think one of the biggest things about self-love is not judging yourself because you're human. You're bound to do mistakes. Again, going back to the parents setting up an example, what you mentioned earlier. It's okay to do mistakes. It's okay to. What is not okay is if you don't learn out of mistakes. Sometimes it takes a couple of mistakes for us to even learn something and then forgive ourselves. The day you forgive yourself, you'll start liking yourself. You'll start loving yourself, and you'll naturally go towards the direction of self-love. Before we end the topic, like we have 10 more minutes. What are the ways that you practice self-love so people can understand, like, what does she do that probably we can do too?
Nothing fancy, all very basic stuff, all very bite-sized, something which can be done in 5 minutes because I don't have the luxury of time on my side, to be
Yeah,
honest.
yeah.
I try to wake up a little earlier than the baby because that gives me some time to practice anything for myself. Because I've noticed specifically, so my baby sleeps early, wakes up super early. So on the days if I don't beat her to waking up, then I sort of just start the day off with her. Whereas if I wake up a little bit before her, even an hour before her, I get time to first and foremost just have some
Sorry,
time
sorry,
to.
sorry, sorry, Dr. Era. Somebody is saying there is audio problem with
Oh, is it?
you.
I'm sorry. Can you hear me? Or is it just for others?
Is it just that this particular person or others? Can anyone else text if there is an audio
I'm
problem?
just going to remove my headphones. Is it better
Yeah.
now? I'm going to try connecting another headphones.
Oh yeah, much better. Actually, even I can hear
One
better.
second. Can you hear better now?
Oh yeah, much better, much clear.
Yeah. Is it okay now? Change my headphones now.
Yeah, it's much better. It's much
Yeah,
better.
audible?
All right.
Yeah,
Okay.
yeah.
I didn't know that those headphones don't work very well. So I was saying I just try to beat my baby up to waking up. That's number one. I get some time to just drink some water or just like do nothing in the morning. Yeah, that's usually how I try to go about. Meditate if I can. Meditation is a practice that I started during my MD days, and I didn't understand anything about it. I was doing it just because our professor used to say "karna hai," so it was a punishment. तो करना पड़ता था, and he would ask "करा है कि नहीं," and it had zero effect because I had zero interest. Only since the last 3 years have I honestly started understanding what meditation is and being able to practice it. And it has started to show any difference. So when people say, oh, can I meditate to get rid of depression or anxiety? I laugh and I say, yes, you must try, because what you try today will yield something later, not just
Yeah.
right now. I journal every time now, not every day, but I journal whenever I can. I make my breakfast every day by myself. For me, that is a big expression of self love because my first meal is in control. I don't rely on anybody for that morning meal, at least, and it's always done in a lot of like slow pace. So for me, that is the best self love that I give myself, eating a mindful meal. That's the only mindful meal I eat. All other are very hassled, right? And I exercise, for me, that is again an expression of a lot of self love because that gives me the happy hormones, that gives me an incentive to kind of, look forward to something in the second half of the day. So I do that in the second half of the day. And yeah, I think these are the major ones that I do pretty much every day. Practice a little bit of gratitude in the journal whenever I find time. One thing I do every day, very without fault, is check in with myself. And that I do every day. So, the last thing at night, I ask myself how my day was. And just okay, the day was overall a decent day to go about, or a day was crappy one, or a day was a very great one because this happened. So just noticing how my mood was over the entire day. That's
Yeah.
something I do every day. But that doesn't require time. That just is like maybe 5 minutes before sleeping. But again, expression of self-love. And on very fancy days when there is time, then obviously like all other women, I like to pamper myself. I like to put on some, face cream, face mask. I like to do my hair nicely. Today I had time, so we tried to put some nail paint. My child put it for me, so it was also a bonding moment. And then I had to take it off. That was me doing my nails, self-care. But yeah, on very rare days, I think one can do a lot. But most other days, it's just the usual. What about you? What is your mantra for self-care on the go?
Um, I mean, I think I take care of myself quite well. It took me many years to get there. Actually, it's not like I was born and then from then I'm only taking care of myself. Um, Somehow, I think in our formative years and even in college time, right? I remember the first lecture in the college I still remember is like, put your patient first. You should never be first. I mean, which is okay. I understand. I think the profession is
No,
as
but the
such that
oath
we
is,
have to,
but the oath says that protect yourself because then you can protect
yeah,
others like
other
that. Like,
people.
don't get
Yeah,
infected by HIV because then you will possibly pass on the HIV to other, or
yeah,
don't get a prick from the needle. That kind of thing is in the final year
yeah.
that we get to learn. You're
Yeah,
right.
yeah, I know. But in first year, as an 18-year
Yeah,
old, I thought like, okay,
yeah,
because I'm in
yeah.
this profession, I'm never the first one. I'm always the last one. But it took me a few years to get to a position where, you know what, no, you have to take care of yourself. Because if you see like obesity and dyslipidemias and cardiac conditions are quite prevalent in population of
Doctors.
doctors.
Correct,
Yeah,
correct.
because of the
Hmm.
lifestyles we lead. So I decided myself that, no, start taking care of yourself because now you're okay. Your body will heal. At one age, it will stop healing. Then what? Right? So I
Absolutely.
started I started taking myself time. Sundays I'm completely giving to myself. I'm not
Excellent.
really. If I had to do any, before I used to pent up all the household works to Sundays.
Oh.
Now I'm not doing anything. I'm
Hmm.
relying on alternate sources. Like there are apps that I can use. I'm using technology to bring home stuff. Before I used to be like one man army. I have
Hmm.
this need to control and need to like do things by myself. I don't like asking for help. I feel
Hmm.
like, I'm okay. When there is a day I'll ask for help. But I decided
Huh.
no, ask for
Hmm.
help and take care of yourself more. So I paint a lot. I used to really
Excellent.
enjoy painting as a kid, which I stopped,
Okay.
along the way. I restarted painting. I started listening to the music that I like. Before, it's always about what are the popular songs and what are the top 10 tracks, and I had to be up to date. I started watching a lot of comedy shows. Before I used to watch all thrillers and things that mess with my head. Now I'm watching a lot of comedy shows, and
Yeah.
I'm taking dance classes, which
Oh,
I
what are
took
you
in my
learning?
school.
What are you
Hip hop,
learning? Which,
hip
oh,
hop.
excellent. I want to
Yeah.
learn shuffling. That's something that my husband and I want to learn. Shuffling.
Shuffling is really cool. Yeah, it's
Yeah.
really cool. Yeah, I just learned top rock of hip hop. I mean, I don't know if my body will permit me to do b-boying and things like that, but hey, you never know.
Yeah. Good, good.
um,
Learning is also a big part
so
of self-love, isn't it?
I have a guitar there. I'm trying to learn
Excellent.
guitar.
All right.
I photograph, so like I have
The
camera.
tattoo.
Basically, I'm
Lovely.
doing things that give a lot of fun to me.
That's excellent. Don't you think
I'm
doctors
trying
also
to
start to feel
balance.
very judged that,
Yeah,
log kya
yeah,
kahenge? What will people think? Oh,
yeah,
if I
yeah,
have a tattoo, what will they say this about me? Oh, if I, so for the longest, my Instagram channel was kind of dormant simply because I used to believe that, oh my God, if I put something out there, it has to be
mm,
medically so on point.
yeah, yeah,
And there can't be anything wrong in it, even like idhar ka udhar, because I'm a doctor, it needs to be a certain way. So that
yeah,
perfectionism kicks in, right? But then I told
yeah,
myself that, what am I doing this for? What is my why here? So I think it's great that you're following all your passions, that you're doing
yeah.
everything that you like. And that's the whole point about being self-loving and caring for your own needs.
Yeah, giving time to self, and being forgiving, and because I mean, I'm sure we all have done a lot of mistakes, and that we carry them, the weight on our shoulders for entire till eternity. So I decided
Yeah.
I'll let go of some things, and some things are out of my control. There's nothing that I could have done to prevent those things. So all these little things
So
are
talk
they all
about guilt,
weight.
because guilt is something that somebody specifically asked in one of the questions, that how to not feel guilty, first of all, about self-love. That's something we already spoke about, and that's your definition of self-love. And second is, how does guilt kind of come in the way of self-love for you?
Yeah. um you punish yourself. Probably you smoke, you drink, you eat all kinds of crap. You treat your body not right. You don't treat your mind right. You don't treat yourself. If someone says that you are this kind of person, you tend to become that particular person
Mm.
just to even
Correct.
out. So
Correct.
there are a lot of self-destructive things one can do to self. Um,
Right.
so I think just simply undoing all those or not doing any of that is enough to be fall in the category of self-love. Treating yourself right.
Yeah. Yeah,
Yeah.
you lost me there again. So another thing about guilt is that it's so detrimental for self-love, and guilt sadly has a very bad reputation as a word. I don't think guilt is a negative word. It's just how we associate it, and
Yeah.
most people feel guilty of even taking out time for themselves.
Yeah.
So that's something I struggle to explain to a lot of people. Like, when I say don't punish your body, please sleep at night when it's necessary. Your body is begging you. Oh no, I'll
Yeah.
feel guilty that I don't have enough time or I'm not doing enough. What people
Yeah.
don't sadly realize is that they're feeling guilty about something which is far more important and pivotal to their basic biological needs versus something like social media. I mean, please,
Yeah.
people can stop watching and go and do 5 minutes of something that is self love right now than just
Yeah.
watch two doctors talk right now, because social media will
Yeah.
never
About them.
change.
Yeah. Yeah.
Yes, do something for yourself rather than being part of just this. So I tell people there are thousands of moments in the day, fleeting moments, which you can take out. So the chai, if I wasn't drinking that chai with you, instead of scrolling through social media and drinking that chai, it could be just a chai date with your own self. And
Yeah.
that is the
Yeah.
whole point. Not with social media, not with 1,000 million random strangers who are not relevant to you. So
Yeah.
feeling guilty about taking out time for yourself, then you have to reassess that where all are you really wasting time. Just
Yeah.
come back to reality that you are anyway wasting a lot of time. Might as well use
Yeah.
your time for self-love.
On yourself. Yeah. Yeah.
Absolutely. Then giving other people thumbs up and likes and whatnot. Right. Sharon,
Yeah.
before we finish,
True.
do you want to take some questions? There are lots of questions who are written here.
Yeah. I'll
One
read
is
out the
how to
questions for
consult
you.
you. One is for you.
Okay. Now I think I answered that.
Okay.
Um, how to deal with your negative emotions without getting rid of your negative emotions.
How do you clean your house without throwing the garbage out?
Oh wow, that's good.
That's the same analogy, right? How to
Yeah.
deal with heart palpitations due to anxiety. Please take it on. This is something we do every day. So you go ahead.
Yeah.
This is something again very profound. I tell people, if your heart is pounding so hard, it's telling you something. It's telling you, and I know some people say, like, what is this mystical explanation? First, I give the biological explanation, the adrenaline, the sympathetic, parasympathetic
Yeah. Yeah.
system. Then I tell them, think about it at a very subconscious level. There is something which is not sitting well with you. If your digestive system is acting up, there is something which is not sitting well in your tummy, right? मतलब there कोई बात हजम नहीं हो रही है, like we say in Hindi. And if
Yeah.
your heart is
Yeah.
pounding, it means it's trying to get out of your chest and run away because it can't face something which is being thrown at it. If your body is tingling all the time, it's a way to say, like, pay attention to me. Give me some good attention rather than only attending to me whenever I give you this warning signs. So
Yeah.
noticing
Yeah.
these body signs and giving self-love to that particular organ or body part is also another lovely way of just bringing in self-love into this. So your heart is pounding
Right.
too hard, do meditation or do deep breathing, which is specific, for the heart, for your cardiopulmonary respiratory system, and you'll like it. You'll feel better. So anxiety भी चली जाएगी, heart palpitation भी चला जाएगा, and you'll be practicing self-love also.
Yeah. True.
Yeah.
True.
Yeah.
Yeah. Somebody is asking if we both cracked neat. Thank God we don't have to anymore.
Sadly, yeah, that's what I was gonna say. I was like, well, the answer is different because we finished our MD way ahead, so lucky.
Yeah. Way ahead.
Yeah. I do journaling every day since 2 weeks, but I'm not able to let out everything what I'm feeling. I write only maximum 4 lines. I think you're doing a good job. Even writing regularly every day for 4 lines is good enough. It's a good start. There's no competition on how many words or how many lines essay is good for journaling. Sometimes I just write good. Sometimes I write like sad. Sometimes I actually doodle in my journal. And it has, when I look back at the doodle, it's such a crappy doodle. Next day I can't make sense of my own doodle. So don't judge your journaling. Journaling is a free expression. It's a way of really putting down whatever is going on inside without really streamlining it. I don't think you need to do anything better. Just keep journaling. You're doing a great job.
Yeah. So, hey, Anmol, you are the one who asked about the negative emotion. So, what I do when I feel negative about myself, I write down what worries me and I strike it off and I write exactly opposite word. That's what we essentially do in cognitive behavioral therapy as well. Channeling the negative thought. You can do that. For example, if I feel worthless, I'm going to write I am worthless. I'm going to strike it off and I'm going to write I'm worthy in capitals. It might sound little like silly maybe, but seeing is believing. When you see it, your brain believes it, and then it tends to work in biological way. So something like that you can try. Like Dr.Era said, doodling works, squiggling works. There are different ways that you can do.
What you said was positive affirmations kind of works. Both is this thing. Yeah, absolutely. Anything that works for you is fine, right?
Right. I think pretty much that's about it.
Somebody got the motivation to exercise. Good for you.
Yeah, glad. Nice tattoo. Thank you so much. It took me a while to do this because everybody told you're a doctor. People judge you for a tattoo.
There you go.
I was giving my USMLE exam in like 2011. They said you won't get through USMLE. Like it won't look good. So like this is my second tattoo. So thanks.
I don't think that these things should judge somebody. Your professional methods, your professionalism reflects in a whole different way. How you are as a person shouldn't really matter how you are as a doctor, because they could be, obviously there are continuity, but then you don't have to be labeled just because of that. Just because you're a dancer and then you're also a doctor. Oh my God, you're a dancer but you're a doctor. It makes no sense. You could be both. The self can be defined in so many ways. I'm a mother and I'm a doctor and I'm a human being and I'm a wife and so many things. So why not, right?
Someone asked me, you seem so happy. How come you have a tattoo? I said, oh, wow.
Oh, okay. I didn't know about that one. That's an interesting one. Great. That's an interesting one.
Yeah. I think that's about it. Pretty much we answered everything.
Great. Thank you so much
Thank you, Dr.Era. So can we say cheers one last time?
Yeah, cheers. My chai is over, but yeah, cheers.
Cheers.
Right. Bye. Have a nice day.
Bye. You too, and Happy New Year. You're having
Thank you. Yeah, today
Bengali
the
New Year?
Bengali New Year, we say Shubho Novo Borsho. So happy New Year to you.
Shubha Novo?
Shubho, Novo, no, Shubho would be like happy. Novo is like
Happy.
new. Borsho is year. So Shubho Novo Borsho.
So Shubha Novo Bosho, everybody.
Thank you so much. You too. Bye.
Bye. Bye.